Hi, I had colon cancer. It sucked. When you have cancer, you often get chemotherapy. Today, I'd like to tell you a little bit about a certain kind of chemotherapy and show you a machine that I built that might make the chemotherapy process a little less terrible for somebody else. I'm going to be reading off of a script on my screen here that I wrote out just to help me from bumbling my words too much. So, here we go. Let me preface all this by saying I'm not a doctor and this is not medical advice. I'm also not selling anything. I'm just a guy who did a thing, and I'm going to tell you how and why. My goal here is to share this information and my experience with doctors, patients, and scientists. Now, a little bit about chemo. Colon cancer chemo is often administered as a pair of medications. One given as a series of infusions, which means it's given through a port directly into your bloodstream, and one given as a whole bunch of pills. The infusion is commonly a platinum-based medication. In my case, it was a medication called oxaliplatin. Platinum-based medications are used for chemotherapy and other types of cancer too, not just colon cancer. Chemotherapy has tons of side effects, obviously, but we're just going to be focusing on one that the platinum-based medications all have in common, called peripheral neuropathy, which means nerve damage in the hands and feet. The nerve damage has a few telltale signs when it's first setting in, and as you might expect, it gets worse the more infusions you have to do. It typically reaches its worst extent actually a few months after treatment concludes. Sometimes this is called coasting, but then it typically gets a little better, although it may still result in some amount of permanent damage. Some smart and nice people out there came up with an idea to reduce the peripheral neuropathy from platinum-based chemotherapy called icing, also known as cryotherapy. What icing entails is cooling the skin in the hands and feet, which causes the blood vessels to close up slightly in a process called vasoconstriction. During vasoconstriction, the amount of blood circulating in the hands and feet is dramatically reduced, but if done correctly, not in a way that is harmful. Because the blood flow to your skin is reduced, the amount of medication in the blood that the nerves are exposed to is also reduced, and so the side effect damage of it is reduced too, or at least that's the hypothesis. It does have a couple studies behind it. I've linked one randomized controlled trial in the description, but of course it could use more studies. It also has my personal experience behind it as well, which I will describe shortly. The upshot is that if done correctly, it won't hurt your hands or feet, it may help them, and it won't make the chemo any less effective. I'd now like to go over why I'm confident that cryotherapy helps prevent peripheral neuropathy in platinum-based chemotherapy. What a sentence that is. I did 4 oxaliplatin infusions, the first with no icing at all, the second with solid ice and ice packs, and the last 2 using a cryotherapy machine that I built. After my first infusion with no icing, I experienced what we believe is the first symptom of peripheral neuropathy, which is extreme cold sensitivity throughout the body. It's a funny coincidence that the treatment and its sensitivity are both about cold exposure, but that's just how it is. It just happens that cold causes vasoconstriction, and cold sensitivity comes from the first stages of peripheral neuropathy. Sorry if that's confusing. Again, that's just how it is. For me, the cold sensitivity was apparent immediately at the end of the first infusion when I went to wash my hands in the bathroom. The room temperature water that first came out of the faucet felt like it had been electrified, or was actually a stream of broken glass. Additionally, over the following week, I would have a very unpleasant tingling sensation when my bare feet touched a cool tile floor of the bathroom, or when my butt touched the toilet seat, or when my finger touched the metal flusher handle of the toilet. And, worst of all, my throat would feel like it was closing up whenever I drank anything that was cooler than lukewarm. This sensitivity spiked immediately after the infusion, and would slowly fade in the weeks between infusions, but it would come back stronger with each subsequent infusion. After using my machine for my last 2 infusions, my hands and feet did not have any cold sensitivity, while the other parts of my body that didn't get the icing treatment still had the sensitivity. This tells me that the cold sensitivity was prevented by the cooling. I believe that also means that nerve damage was prevented. I cannot be 100% confident that damage was prevented, but the first symptom of damage was completely removed, which makes me quite confident. In the months that followed treatment, I still experienced the coasting effect of some numbness and tingling in my feet that set in slowly over the month or two that followed my last infusion, but which ultimately went away. Some people say the coasting is due to damage in the spinal cord rather than in the extremities, but I don't know. The coasting damage isn't able to be addressed by icing, and neither is the cold sensitivity in the throat to any great extent. I tried my best with slushies and chugging ice water to address the throat sensitivity, but it's just not easy to do. Some people have success with that. However, the cold sensitivity in my hands and feet was effectively prevented by using my cryotherapy machine. The icing process could be done with cold packs and ice, and I tried doing it this way for one of my 4 infusions, but it has a few problems. Frozen solids can cause frostbite if you're not careful with how cold it gets things. Ice melts and gets you wet and makes a mess. Cold packs alone often can't do enough consistent cooling for as long as needed, especially against a warm body. And using a solid object means only the skin that's in direct contact with the flat surface actually gets cooled. According to a study of cold injuries I found on UpToDate, which I'll link in the description, applying cold to the skin will not cause damage as long as 3 things are maintained. The cold is above freezing, it's dry, and it's kept relatively short, as in less than 14 hours. I also felt it was important when using the machine to have an infrared thermometer on hand to make sure I was reaching the target skin temperature of 59 degrees Fahrenheit, or 15 degrees Celsius, but not lower. Cooling to lower temperatures causes what is called the hunting response, where the body alternates between vasoconstriction and vasodilation in 5 to 10 minute cycles, which is counterproductive to our goal. However, while using the machine, I never actually had a problem with my skin getting too cold, but I thought it best to use a thermometer just to be sure. There are actually professionally made cryotherapy machines already out there that accomplish the 3 safety factors well by pumping cold water through bags called cuffs that you strap onto your desired body part. They're used for things like sports injuries and surgery recovery. My problem with these machines is that they are expensive for how simple they are. I also couldn't find any that could cool more than one area at a time, so you'd end up buying 4 separate machines to do both hands and both feet if you're trying to use it for colon cancer chemotherapy or some other type of platinum-based chemotherapy. The one I thought looked most promising was one from Polar, which has cuffs specifically for hands and feet and costs $220 on Amazon. Link in the description. So to do all your extremities, you would have to buy 4 of them, and that would be about $900 that I'm pretty sure insurance would not cover because it hasn't been studied enough yet. So instead, I built my own for about $200, and that's what I'm here to show you. I'll now show you the machine in operation. Here I have the cooler filled with about 3 gallons of water, but no ice, just for the video. For real use, it's a good idea to chill the water in milk jugs in the fridge the night before, and you'll want to buy a big bag of ice too. You also want to bring a power strip and extension cord to make sure you can plug in wherever an outlet might be. You'll also want a helper with you to top off the ice and help you drain it at the end. I've connected all the lines and I've got my cuffs on. Now I just flip the power on. The cuffs will begin filling with water and cycling it back to the cooler. It's a good idea to start the cooling process about a half hour before your infusion starts to give it time to kick on, and to continue it for about a half hour afterwards to give the chemo time to settle out. Here you can see the water coming through the tubing and starting to fill up the cuffs as they inflate. Sometimes air gets trapped in the cuffs or the tubes, and you'll see it bubbling out into the cooler. One thing you can do to help get the air out of the cuffs and the tubes is to raise the lines in between the cuffs and the cooler, just to give the air someplace else to go. Give a little help getting out of there so you don't have a circulation problem there. so do it for both the hands and the feet. And when it's time to stop, just turn the power off and raise the cuffs into the air to allow them to drain. Be careful when you're done though, because if you leave the cuffs sitting on the floor with a little bit of water still in them, they'll probably start a siphon that will fill them up again. So pick them up and put them on the chair while you empty out the cooler. Now, on to how I made my icing, or cryotherapy machine. As you might expect, the whole thing starts with a cooler full of ice and water. For me, this was a 16-quart cooler, but I'm sure a larger one would work fine too. The water is sent through vinyl tubing by 2 outdoor fountain pumps. One larger pump is used for the hands, and one smaller pump for the feet, with each of the lines divided by T's to go out to each foot and hand. I tried using just one pump instead of 2, but because the hands and feet are at different heights when sitting, I couldn't get any flow over my hands because they're higher up. That's also why the hands use a larger pump than the feet. They could probably both use the same larger size pump, but it saves a couple bucks if you use a small one and a large one. At the ends of the vinyl tubes are 4 custom-made cuffs that wrap around the hands and feet, that each have an inlet and outlet tube. I added insulation to the cuffs in the form of a cut-up camping sleeping pad held on with Velcro strapping, and added insulation wrap to the vinyl pipes in between. The hardest part of making this machine, and probably the only part that isn't self-explanatory, was making the cuffs and sealing them to the vinyl tubes. The cuffs are made from the plastic normally used for vacuum packing food for your freezer. This plastic sheet comes in large 2-ply rolls for relatively cheap, and it can be easily melted in a controlled way with a normal clothes iron. You're going to end up with more plastic sheeting than you actually need, so it's a good idea to make a few practice pouches of just sealed in air so you can figure out how hot your iron needs to be and how fast to move it. To make the cuffs, I just took big enough pieces of plastic wrap to wrap around my hands and feet, cut 2 holes at different corners of the bags for the inlet and outlet tubes. I used a penny as a template for the holes, attached the fittings, and then ironed the outside edges to seal them shut. I was also careful to position the fitting openings so that they stick out of the same side in a convenient way when the cuff is all wrapped up. I experimented with adding flow channels or restrictions inside the cuffs, but I found that was not worth the trouble, and it prevented the cuffs from making complete contact with the skin. To make a watertight connection between the tubing and the cuffs, I used electrical conduit fittings that come with a rubber gasket and a nut. It's a little bit tricky to adjust the sizing to go from the conduit fittings down to the size the pumps need, and that's why there are 2 sizes of tubes used, but it gave me a good opportunity to add screw-on fittings that make it easy to assemble and disassemble. I'll show on screen now a list of all the parts I used and where I got them. I'll also leave a link to a Google spreadsheet in the description with that same information. If you have any questions or comments, please let me know and I'll do my best to answer them. One last thing. I recommend getting a colonoscopy. Half of all colon cancer cases show no symptoms, and colon cancer is happening in younger and younger people, but nobody knows why. When you get a colonoscopy, they also remove polyps they find, which are the precursors to cancer. So not only can you detect cancer early, you can actually prevent it. Thanks for watching.